Cognitive impairment, focusing on delirium, is presented by Kelly Barbuto, a clinical nurse consultant in dementia and delirium at South East Sydney Local Health District. And she shares practical strategies for preventing, identifying and managing delirium.
Welcome. Today we're talking about cognitive impairment. It is a significant component of the CEC comprehensive care, minimising harm model. It is often misunderstood and under-recognised. So here is Mrs. Betty Smith, 83-year-old female, presented to hospital post-fall. She lives alone. Her chronic medical conditions are currently stable. She has hearing and vision impairment, has a painful right arm, and poor medication compliance was noted by the New South Wales Ambulance Service. Does this sound familiar? You meet Mrs. Smith on the ward and assist her out of bed, manage to stand her up and assist with transferring her into the chair. She's been diagnosed with a right Colles fracture. She insists she's okay, but rather abrupt with you. She's quite distracted with other noises and people in the room, looking around, talking to herself. When you return to her room, she asks, "Who are you and when can I leave this jail?" And you noticed her breakfast is untouched. Family members may say to you that my mother or father just aren't themselves. They're confused, falling asleep while I'm talking, picking at things and thinking I'm my father. We often see these words written in the notes without recognising they could be a sign of delirium, and no investigation or escalation occurs. We're looking at things such as drowsiness, agitated, non-compliant or pleasantly confused. Delirium is an acute change in a mental status. It is a medical emergency. It develops over a short period of time, from hours to days, and is such characterised by disturbance of consciousness, attention, cognition and perception. There is a disturbance in psychomotor behaviour. It is often under-recognised, and it's important that we prevent, identify, treat and manage delirium. The types of delirium are a hyperactive delirium. Your patient may be aggressive, confused, agitated, up at 3 a.m. trying to leave. The hypoactive delirium, they're quietly sleeping, a lot of refusal of medications, allied health intervention, food. And then we have a mixed delirium, which is a combination of both. If delirium is not assessed and managed, we often see behaviours escalate. A person with delirium is at an increased risk of falls, length of stay, and ultimately death. They might have a permanent cognitive impairment, and it may lead to requiring discharge to a residential aged care facility. For older people, there are many factors for developing delirium. Some of the key risk factors include age, so over the age of 65 or 45 for Aboriginal and Torres Strait Islanders or people with an intellectual disability, a severe medical illness, surgery, hip fracture, infection, constipation. You need to screen for delirium on admission or when there is a change in condition, such as function, cognition, concentration, memory, thinking, decision making. If there is a new onset of confusion or a change in behaviour. And note that the ACV alert, confusion, change in behaviour, rousable by voice or only rousable by pain, an unresponsive scale, is a medical emergency for an escalation. A positive result on a validated screening tool requires escalation for a medical review. When a patient is identified with delirium, teamwork and communication are essential. Working as a multidisciplinary team to identify underlying causes, identify, implement and document strategies to address risk factors. It's important to include this information in bedside clinical handover and communicate with all team members regularly during safety huddles and our multidisciplinary rounds. Delirium management strategies to consider. Ensure pain is identified and managed. Make sure they are eating their meals and well hydrated. Check if they have hearing aids, they are being used and are working. And check if glasses are required and available. Ensure to monitor bowel and bladder function. Promote good sleep hygiene, so sitting up out of bed, daytime activities and quiet nighttime environment. And use tools to support communication with patients, such as cue cards or top 5. Involve family and carers and encourage them to be there during the meals, handover and at multidisciplinary rounds. Orientate patient to the room, ward and time and place regularly throughout your shift and support safe mobilisation. To supporting patients with delirium, get them up out of bed, showered and dressed in day clothes. Assist to mobilise and sit patients out of bed. Assist with meals, offer regular fluids and assist patients with dental hygiene. Monitor bowel and bladder habits. Ensure use of aids to assist hearing and vision. Pain and discomfort is addressed and ensure the careful use of medications, investigations and interventions. A quiet, calm environment and encourage family presence if available. These are the fundamentals of compassionate care. We're going to be Betty-centred. So we're going to provide gentle reassurance, reorientate, distract and agree if necessary. Involve family members. Consider a top 5 or a sunflower tool. Provide increased supervision. Have low lighting at night. Promote any early removal of medical attachments where possible. Take Betty for regular walks and have familiar objects and provide sensory distraction such as music and other activities. Tools to support communication include using visual pictures or objects to trigger understanding when words fail, orientating with a clock that shows day, date and time, using cue cards. And to provide person-centred care, we need to improve our engagement with family and carers. Using tools, as the sunflower and top 5, provide us with personal information that can be used to assist in understanding behaviour, patient preferences and engaging with patients on a personal level. The following resources are available to support you. Please have a look at the 2 heady modules in the statewide delirium brochure, as well as the top 5 and sunflower brochure. Remember, delirium is a medical emergency. It's important to prevent, identify, treat and manage delirium.